Alright, so I've gathered my equipment for my head-to-toe assessment. Hi there, my name's Taylor. I'm going to be your nurse today. Can I have your name and date of birth, please?
Lara Goulding, December 29th, 1997.
Alright, awesome. I'm going to go ahead and wash my hands, put on my gloves, and close the curtain for your privacy. And what we're going to be doing today is a head-to-toe assessment. So I'm just going to get some more information about you and your body so that we can proceed with your medical care. Before we start, do you have any pain?
No.
Do you need to use the restroom?
No.
Alright, so we're going to go ahead and get started. And first, I would assess her overall appearance, so I can tell that Lara is well-nourished, she is comfortable, and she is clean. She has good hygiene. And then next, I'm going to get her orientation and see if she's oriented. So can you tell me your first and last name again, please?
Lara Goulding.
And Lara, do you know where you are right now?
I'm at home.
Okay. And what month is it?
It is November.
Perfect. So I would say that Lara is awake, alert, and oriented. And next, I'm going to go ahead and I would get some vital signs, which would include temperature, blood pressure, pulse rate, pulse ox, and respirations. And as we're going through, I would also assess for her skin color, temperature, and moisture, which all look normal to me. There's nothing abnormal about it. I'll use the back of my hand to test. And now we're going to get started with her cranial nerves. So cranial nerve 1 is the olfactory, and to test olfactory, I'm going to have Lara close her eyes. I'm going to plug one nostril at a time and place a scent under her nose, and Lara's going to identify that scent. And then I'm going to plug the other nostril and put the same scent under, and she's going to identify that as well. And then if she properly assesses both smells, then we know her olfactory nerve is intact. And then next, we're going to do the optic nerve, which has to do with Lara's vision. And doing this, I would use the Rosenbaum test, which is a piece of paper with images on it. She'll hold at about 14 inches away, and then she will read the line. And if she can read the line with no errors, then I know that her optic nerve is also intact. Next, we're going to do cranial nerves 3, 4, and 6, which in order are oculomotor, trochlear, and abducens, and those all have to do with eye movement. So I'm going to go ahead and use my pen light, and Lara, please follow this pen light. We're going to go side to side, and then up and down, and in and out. And then I'm going to take my light, and I'm going to put it around the corner of her eye to test her pupil reactivity. And all seem well, so I can tell that her pupils and eyes are equal, round, and reactive to light and accommodation. And that being said, her optic nerve is intact. And then next, I'm going to go to cranial nerve 5, which is the trigeminal nerve. And this is facial sensations. So Lara, I'm going to use a hard and a soft object, and I want you to tell me where the object touches your face at, and if it's hard or soft, okay?
Soft on my upper right forehead.
Okay.
Soft on my left forehead. Hard on my left forehead.
All right, perfect. And that being said, her trigeminal nerve is intact, but I'm also going to have her clench her teeth for me. Perfect, okay. And then we're going to move on to cranial nerve 7, which is the facial nerve, and has to do with facial movements. So Lara, I'm going to have you smile for me. Can you frown? Puff out your cheeks. And now wrinkle your forehead. And close your eyes real tight. All right, perfect. And I can see that Lara's facial nerve is also intact. And then next we're going to do cranial nerve 8, which is vestibular cochlear. And to test this, we're going to perform the whisper test. So I'm going to plug one of Lara's ears and whisper something behind her head and have her tell me what I said.
Boat, float.
And then the other ear. Purple shirt. All right, and I can tell that Lara's vestibular cochlear nerve is also intact. And then next we're going to do cranial nerve 11, which is the accessory nerve, and it has to do with the sternocleidomastoid. So I'm going to put my arms here and have Lara shrug her shoulders. And she can push against my hands, so I know that that accessory nerve is also intact. And then lastly, we're going to do the 3 nerves that have to do with tongue movement and taste and swallowing, which is cranial nerve 9, 10, and 12. It's the glossopharyngeal, vagus, and hypoglossal nerve. And to test this, I'm first going to ask Lara, Lara, can you take a swallow for me? All right, Lara can swallow. Can you please move your tongue up and down and side to side? And Lara's tongue movements are also intact. And then I can also test if Lara has taste perception. So I'm going to pick either a sweet or sour taste and put it on her tongue and have her identify which of the two it is. And then I'm also going to check inside her mouth, and Lara, can you open and say ah, ah, and she can do that, so we know that these nerves are also intact. But while I'm here, I'm going to inspect Lara's oral cavity, and I can see that there are no lesions, there are no abnormalities, everything looks normal inside her mouth. And I'm also going to take a step back and inspect her. Oh, and that concludes our cranial nerves. And then I'm going to take back and assess her overall, so I can tell that her face is symmetrical. She has no lesions or anything abnormal about her head. And then we're going to move into, I'm going to palpate her her lymph nodes. So I can palpate her lymph nodes. And there's no swollen lymph nodes or anything. So I'm going to take a step back and I'm going to look at her carotid arteries in her neck. And everything's symmetrical and normal there. So I'm going to go ahead and listen to her carotid arteries one at a time, being sure not to cut off the circulation. All right. And then I'm going to go ahead and palpate them as well. And both of her carotid arteries have strong pulses. And next, I'm going to move into her upper arm assessment. So I'm going to go and look at her arms, and I'm going to feel with the back of my hand. And I can tell that her skin is moisturized, but it's not too dry or too wet. And I'm going to also check the color, and the color is uniform. She has no bruising or lesions. So next, I'm going to test for Lara's, I'm going to do some range of motion tests. So Lara, go ahead and push on my hands. Good. And then go ahead and squeeze my fingers. And I'm also going to look at your fingers, and we're going to test for capillary refill. And it refills within 2 seconds, so that's clean and good. And I'm going to go ahead and check your radial pulses as well. And we're going to do this at the same time and check for symmetry. And I'm going to check her brachial pulses as well. And both pulses are strong and symmetrical, so I know there are no interruptions in her blood vessels or anything. And next I'm going to move into her thoracic assessment. So I'm going to look at her thoracic cavity, and I can look at the front and look at the back, and there are no, and this you would also do skin to skin. You want to see it without a shirt on so that you can be sure there is no bruising or discoloration. But for the time being, I'm going to let her keep her shirt on. And I'm going to look, and I can see that there is no distortion. Her cavity is filled, it's symmetrical, and I'm going to test for skin turgor. So I'm going to lightly pinch her skin, and it returns back, so she has good skin turgor. And then I'm going to go ahead and auscultate her heart first in the 5 heart sounds. So I'm going to start here with her apical, and then we're going to go, or not her apical, her aortic, and then we're going to go pulmonic, Erb's point, tricuspid, and mitral. So this you would also want to do on bare skin. So you're going to go aortic, pulmonic, Erb's point, tricuspid, and mitral. And the mitral location is also where you can find the apical pulse, and you want to listen to the apical pulse for 1 minute to get someone's right heart rate. And then next I'm going to listen to her thoracic sounds. So Lara, I'm going to have you turn sideways in your chair just to make this easier. Thank you. All right, we'll do your front first. You're good there. And we're going to listen to 8 places on the front, and you want to be sure not to listen over bony prominences because you're not going to hear through bone. So I'm going to listen to 8 places, and I'm going to start at one side and do the same spot on the other side. And go down. And take a big deep breath in and a deep breath out. And every breath is a full inhalation and exhalation, and you want to listen for that full breath sound. you. Now we're going to listen to her back, and we're going to listen to 10 places on her back. And the same thing. So go ahead and take a deep breath in and out. And after one breath, you're going to go ahead and move to the other side. Alright, and her lung sounds are clear. Lara, you can turn back around. Next, we're going to perform the abdominal assessment. So, Lara, I'm going to have you lay on this couch and turn your head around. Perfect. You can scoot this way if you want to. And if you want to just take your socks off while we're at it so we can do your legs later. Thank you. Alright, and Lara's exposed her abdomen so that I can see. And for the abdominal, we're going to start with inspection, and we're looking for any abnormal coloring, distensions, bruisings, anything like that, and Lara has none of that. And next we're going to auscultate before we palpate or percuss. So I'm going to auscultate starting in the right lower quadrant, and then the right upper, the left upper, and the left lower. And you're listening for bowel sounds. And then after that, I'm also going to percuss in the same order on her abdomen, and then I'm going to palpate the same order on her abdomen. And then next I'm going to move and I would palpate her femoral pulse. And then after that I would inspect her genitalia area for any abnormal colorations or lesions or anything out of the ordinary. And then next I'm going to move down to her legs. And we're going to go ahead and expose Lara's legs for this. And first we're going to inspect, and we're looking for any discoloration, any her legs are moisturized, they are not too dry or too wet, they have a uniform color. And then next we're going to go ahead and perform some range of motion exercises on her legs. So Lara, can you please bring your knees to your chest? Thank you, and you can put them straight. Alright, and I'm going to have you push against my hands with your feet. Alright, and then pull towards you. And Lara can perform all of these tests, and we'll check for the capillary refill in her toes as well, which is within 2 seconds. So Lara, you can go ahead and pull your pants back down. And then next we want to assess gait. So Lara, if you want to stand up, I'm going to have you take a few steps. Alright, and we can tell that Lara has a very steady gait. And then next we're going to perform the Romberg test, which has to do with balance. So Lara, come and stand here, please. I'm going to have you put your arms at your side and close your eyes. And she's going to do this, and this tests her balance. She's going to do it for about 20 seconds. I'm going to lightly give her a touch, and she can remain her balance and composure so that you know she does have that balance aspect. And then as I'm performing these, I would just document as I'm going and then send these over, and it will allow me to better assess her medically. And that's it for the head to toes. Alright, so now we're going to move on to the lower extremities. So I have Lara's leg exposed so that I can inspect her skin, and I can see that there's no discoloration or bruising. I can feel with the back of my hand for temperature, and her temperature and moisture are both normal. And next I'm going to do the pulses in the legs. So we're going to do the dorsalis pedis first, and then the posterior tibialis, and then, or the posterior tibial, and then we're going to do the popliteal pulse. And then next we're going to check Lara's range of motion. So Lara, can you bring your knees to your chest, please? Good. And you can put them down. And then I'm going to have you push against my hands and pull against with your toes. Perfect. And Lara's range of motion is good as well. So Lara, I'm going to have you stand up and take a few steps so I can assess your gait. And we can see that Lara has a steady gait. So next I'm going to have her stand with her legs together and her eyes closed, arms at her sides with your eyes closed. This is the Romberg test to check for balance. So she's going to close her eyes, and then she's going to hold this position for about 20 seconds. I'm going to give her a light touch. And she can remain her composure and stand straight so we know that her balance is okay. And then as I'm going, I would just document all of my findings. And when I leave the room in a hospital setting, I would make sure she has her call light and everything else that she needs, her belongings.